Arthritis is on the rise, and most people will experience some form of it during their lifetime. One striking fact, even after diagnosis, roughly 1 in 5 people don't actually know which type of arthritis they have. That distinction matters enormously, including for how you eat, because the two most common forms of arthritis have very different root causes. The word arthritis comes from the Greek arthron, joint, and itis, inflammation. But not all joint inflammation is alike. Broadly, there are 2 categories. Rheumatoid arthritis, an autoimmune fire. Rheumatoid arthritis, RA, is the more aggressive of the two. It produces an intense burning inflammation that is acute, systemic, and critically, driven by the immune system itself. The immune system releases inflammatory messengers such as TNF-alpha, interleukin-1, and interleukin-6 to signal distress, a phenomenon often called a cytokine storm. This storm attacks the joint capsule directly. Picture a knee joint. The capsule surrounds the joint, and inside sits synovial fluid, which delivers nutrients, since the joint itself has no blood supply. In RA, this inner environment becomes inflamed and irritated. Because RA is erosive, it progressively destroys bone ends and cartilage. One classic sign is ulnar deviation, the fingers bending toward the pinky side as the joints break down. Because RA originates in immune system overactivity, standard treatment relies on immunosuppression. If the immune system is attacking the body, the strategy is to dial down the immune system itself. This can relieve symptoms, but it also weakens the immune system's ability to do its normal job of protecting the body. Osteoarthritis, a metabolic problem. Osteoarthritis, OA, is far more common. It shares some features with RA, including inflammation, but the underlying cause is different: poor metabolic health rather than an immune attack. The inflammation in OA is chronic, localized, and low-grade rather than acute and body-wide. Poor metabolism, often rooted in insulin resistance, leads to chronically elevated blood sugar. When excess sugar binds to proteins in the blood, it creates compounds called advanced glycation end products, AGEs. These AGEs cause damage throughout the body, and in joints and cartilage specifically, they stiffen, weaken, and degrade cartilage tissue. Add in uneven wear from poor posture or uncorrected imbalances, and breakdown starts to outpace repair. Joints aren't built to last a lifetime unchanged. They're constantly remodeling, breaking down and rebuilding. In a healthy person, this cycle stays balanced. But once the processes described above take hold, degradation outweighs reconstruction, and the joint deteriorates. As cartilage thins, the body tries to compensate by growing extra bone around the joint's edges. In an arthritic knee, the central cartilage disc thins until bone eventually meets bone directly, the point at which many people end up needing a knee replacement. Around the joint's margins, the body lays down small, bony nodules as a compensatory response. This same pattern shows up in the hands, where finger joints thicken and develop visible nodules near the joint's outer end. OA is typically managed with regular systemic anti-inflammatory medications, which can be fairly hard on the digestive system over time. A healthy joint has thick, cushiony blue cartilage that guides smooth movement and straight fingers. An arthritic joint shows thinning cartilage and extra bony nodules. Why diet matters for both. RA is autoimmune in origin. OA is metabolic, but both are inflammatory conditions, even though the intensity differs. The foods we eat can either fuel that inflammation or calm it. This is a key reason diet-based approaches often outperform relying on medication alone. Drugs address symptoms, not root causes. Medication has real value in providing relief while you work on the underlying drivers, but medication without lifestyle change simply allows the disease to keep progressing. Below are 10 dietary categories worth understanding. 1. Sugar and refined carbohydrates. Sugar and high fructose corn syrup spike blood glucose quickly. In RA, these spikes stimulate the release of inflammatory cytokines, raising the risk of flare-ups. In OA, elevated blood sugar accelerates AGE formation, stiffening and degrading cartilage over time. Most people now recognize sugar as harmful, but many still assume refined carbohydrates are safe because they're labeled complex starches. White bread, rice, crackers, and cereal are often treated as fundamentally different from sugar, yet many of these foods have a glycemic index equal to or higher than table sugar, meaning they cause blood sugar spikes that are just as frequent and severe. This single factor is arguably the biggest driver of metabolic disease, osteoarthritis progression, and RA flare severity. 2. Industrial seed oils and high-heat cooking. Industrial seed oils are rich in omega-6 fatty acids, which break down into arachidonic acid. Arachidonic acid activates a signaling molecule called prostaglandin E2, PGE2, which is pro-inflammatory. This is the core mechanism by which excess omega-6 fat becomes inflammatory, and most people consume 20 to 30 times more omega-6 than is recommended, throwing off the balance with omega-3s. There's a second problem. These polyunsaturated fats have multiple double bonds that are highly reactive and prone to breaking down under heat and oxygen exposure. That breakdown produces toxic byproducts called aldehydes. During manufacturing, seed oils are exposed to extreme heat, generating large amounts of aldehydes, which is why the oil must then be deodorized, a chemical process that strips out both the aldehydes and the oil's natural protective compounds like tocopherols and polyphenols, which normally guard against oxidation. The result is a bland, odorless oil that's also defenseless. Once heated again in cooking, it oxidizes easily and generates more aldehydes. This is a particular issue with fried foods, which are repeatedly heated to very high temperatures using this same type of oil. Just as sugar can bind to proteins, these aldehydes can bind to proteins too, forming compounds called advanced lipid oxidation end products, ALEs, a process with damage patterns similar to accelerated aging. In RA, this translates to more inflammation and more frequent flares. In OA, it shows up as cartilage damage resembling premature aging. 3. Dry heat and high-temperature cooking methods. Grilling, charring, and smoking generate heterocyclic amines, HCAs, compounds that can be harmful in excess. A practical fix: marinate meat beforehand. Antioxidant-rich herbs like basil and thyme, combined with an acidic ingredient such as vinegar, lemon, or lime, can reduce HCA formation by up to 90%. Garlic and ginger are also useful additions. It's also worth watching dripping fat during grilling. When fat renders and drips onto heat, it creates smoke containing polycyclic aromatic hydrocarbons, PAHs. Trimming large fat deposits and avoiding flare-ups helps limit this. Browning and high heat also promote AGE formation, similar to the sugar-driven mechanism described earlier. 4. A nuance on red meat and fat. People often hear that red meat or grilling is inherently bad, but the picture is more nuanced. The body produces its own endogenous fat from blood glucose and protein, and this process is directly tied to insulin resistance. The higher your blood sugar, the more this occurs. Separately, exogenous fat comes from food itself, but cooking, browning, and eating a food doesn't automatically mean that fat ends up stored in your tissues. In fact, only around 10% of dietary fat from food is typically absorbed and retained, while fat your body manufactures internally is stored far more readily. Research on how much dietary saturated fat actually ends up in body tissue and how harmful it truly is remains mixed. Some studies that cut saturated fat intake, eliminating grilled foods for example, found no meaningful drop in the body's total saturated fat stores. The takeaway: Blood sugar control matters far more for these outcomes than avoiding grilled food altogether. Mild, chronic high blood sugar can do more damage than an occasional grilled meal. The priority should be managing blood glucose, not fearing grilling itself. 5. Gut health and the microbiome. The gut and its microbiome heavily influence systemic inflammation and immune function. Low-grade systemic inflammation can originate in the gut, playing a role in osteoarthritis, and most autoimmune conditions, including RA, also have gut-related roots. 6. Alcohol. Alcohol directly damages the intestinal lining, increasing gut permeability. This allows harmful bacteria to flourish and produce toxic byproducts called lipopolysaccharides, LPS. When LPS enters the bloodstream, the immune system mounts a strong systemic response. In RA, alcohol is a well-documented trigger for flare-ups. In OA, it adds to overall systemic, low-grade inflammation. 7. Gluten. Gluten's reputation is more complicated. It can weaken the intestinal barrier in sensitive individuals, allowing larger food particles to cross into the bloodstream and trigger immune reactions. Evidence here is real but inconsistent. Studies vary, and many people have mild, undiagnosed gluten sensitivity. For both RA and OA, gluten can act as a flare trigger or contribute to inflammation in sensitive individuals. Unlike celiac disease, gluten's effects here aren't clear-cut, so an elimination trial, removing it and observing results, is a reasonable way to check personal sensitivity. 8. Nightshades, tomatoes, eggplant, etc. Nightshade vegetables contain lectins, mildly toxic proteins that plants use as a natural defense mechanism. In someone with a healthy gut barrier, a solid mucus layer and balanced microbiome, lectins are broken down before they can cause problems. But in someone with a compromised gut lining, thin mucus layer, or imbalanced microbiome, lectins aren't fully broken down and can bind to the intestinal wall, triggering inflammation. In other words, for many plant foods, gut health matters more than the food itself. In both RA and OA, a permeable or otherwise compromised gut can turn ordinarily fine foods into flare triggers. An elimination trial can help identify whether this is a personal issue. 9. Emulsifiers. Found in nearly all processed foods, emulsifiers improve texture and consistency, but they also damage the thin protective mucus layer of the gut and can disrupt the microbiome's balance. This increases intestinal permeability and circulating LPS. Notably, emulsifiers have been shown to reduce Akkermansia, a key protective bacterial species that maintains the gut's mucus layer. In RA, this can contribute to gut permeability and more frequent flares. In OA, the same mechanism drives greater systemic inflammation. 10. Artificial sweeteners. Saccharin, sucralose, aspartame, and acesulfame potassium were originally marketed as healthy sugar alternatives. But growing research, including fecal transplant studies, shows they directly alter the gut microbiome, reducing protective bacteria and increasing intestinal permeability. In RA, this raises gut-driven systemic inflammation. In OA, it contributes to broader systemic inflammation through the same pathway. The bottom line: rheumatoid arthritis and osteoarthritis have different root causes, one autoimmune, one metabolic, but both are fundamentally inflammatory conditions that respond to dietary choices. Reducing refined sugar and high glycemic carbs, minimizing damaged fats from high-heat cooking and industrial oils, supporting gut health, and identifying personal food sensitivities, gluten, nightshades, can meaningfully reduce flare frequency and slow joint degeneration, often complementing medical treatment rather than replacing it.